I know I think we are almost 3 minutes ahead of the time, but let's just start. Is that okay? Okay, great. So hello again. Thank you so much for being here, and hello for online participants here. It's really nice to see you too, Sara, Tamra, Rar. And so we are on unceded land here, and it's always been and will always be an Aboriginal land. A question of how do we question the historical injustice, but an ongoing injustice on First Nations. And also as we think about public health questions, what do we think about in the historical and current context makes it much more harder. And I think gender is another whole aspect which makes it much more of a lens to unpack and more learn to move forward the discussions, right? So today we have excellent and amazing scholar with us, Sara Davies, and Diego is the one who nominated for our conversation series, and unfortunately he's not here, but then I'm sure he will listen to you and our conversations for today. So for those who don't know Sara Davies is a professor of international relations at Griffith University and deputy director of Indo-Pacific research at ARC Center of Excellence for Elimination of Violence Against Women. And she has so many amazing projects. And I think if you're interested in violence and questions at the intersections with gender, feel free to look through her works. So I don't want to take much of the time. So the format is like Sara would be giving a talk for 25 to 30 minutes, and then the rest we will have a conversation because it's a conversation format, right? So, and then of course, for people who are in person, we'll head to the lunch and continue our conversation. And sorry for people who are joining online for missing the lunch. But yeah, Sara, over to you.
Sure, my time is on. Okay. Thank you so much, Supriya, for a really lovely introduction and generous introduction. And thank you for inviting me to the beautiful campus today. Really appreciate it. Just started, so it's all good. Get comfortable. And thank you those of you online as well for joining. And yes, I really appreciate being invited today as an international relations scholar. So I don't have the public health background, although I work with individuals, including Claire Wenham, who do. So it's a real pleasure to be able to be in an environment today to be asked questions that maybe I may not necessarily always get when I present this work in other spaces. So thank you again for the invitation. I would like to, before I begin, acknowledge just I'm from Griffith University and I'm a guest today on the lands of the Eora Nation, and I would like to sincerely pay my respects to elders past and present in this beautiful campus and lands upon which we're so fortunate to be able to enjoy. And I acknowledge that these lands have and always will remain unceded. And I pay my sincere respect to all Aboriginal and Torres Strait Islander peoples. As you saw from the beginning of the presentation, we're looking in this paper and the project that we've been doing, Claire and I, has been looking at, we call it Searching for Gender, in the current draft pandemic treaty, which I'm going to be talking about in a moment. But I really think it's important first to present, I suppose, the way in which we're approaching gender in this paper and in this project, and to not to lead to assumptions about the fact that even though we may at times in the paper and the presentation present this idea of binary, that's certainly not our intention here. We're very much aware of the fact that the concept of gender in particular is a social perception of sex roles, and that also we know that binaries is also removes, if you like, the importance acknowledgement of different ways of thinking about sex, as well as indeed gender in different societies as well. And there's a really excellent piece that's been written by Ekaterina Yukayo-Krevenka, who has argued that in particular in the area of international human rights law, which is what we're going to be looking at in this presentation, there is a real problematic sort of discourse that occurs here where we see an inability really to be able to move beyond still these binary conceptions, and these binary conceptions even inform the concept of gender as well. And so what I think it's really important to keep at the back of our minds is the fact that when we're looking at these works, where in particular rights law or conversations and developments in relation to concepts at the international level, we need to acknowledge that the siloed position is problematic. that there is a need to be always looking for ways in which sexual orientation and gender identity is being re-understood, and to not necessarily assume in these instances that we shouldn't be always thinking about and engaging with the way in which there can be opportunities to make these moves to be more inclusive. So today, as I said, I'm going to be talking about the pandemic agreement. But first, I'd like to just give a little snapshot, if I could, about two crises that we felt were operating, Claire Wenham and myself felt were operating at the time when we were asked to do this study, which I'll be explaining in a minute. The first one was this sense that health cooperation is in crisis. So in the aftermath of COVID-19, and of course during it, there was this sense, or definitely a reality, that the concept of global health and the ideas underpinning it in terms of multilateralism, that it's about cooperation, that it's about distribution, that it's about justice, is certainly not being lived and experienced by those who were experiencing the COVID-19 outbreak, or indeed long before. And I know this group in particular has some fantastic scholars who's done a really incredible work looking at the way in which global health as a concept has origins of an imperial and colonial past that need to be acknowledged and reckoned with and haven't been to date. And certainly in the case of thinking about the way in which cooperation around issues such as, pathogen sharing or vaccines, what we see here is this unequal distribution of priorities, of access, and who has power and who doesn't. And so one of the, I suppose for us, the underlying questions in thinking about this project was actually thinking about, first of all, when we're thinking about trying to achieve something like an agreement between states primarily to try and make sure that there's better cooperation in any area of health, is thinking about, first of all, well, who is getting to participate in these cooperation conversations, whose priorities are going to be considered here, and then as well, how does even the concept of access, distribution, equity are being thought about in these ways need to be always, if you like, reckoned with in the sense of that historical past of owning these terms. And this particular one that I was reading in preparation for today about the liberal script. And the liberal script is always about, access and rights and distribution for all individuals without taking into account the fact that we already have these very biased priors as to who is the individual and who has access and who has rights in the first place. On the other hand, though, and I'm sorry, those of you who are in Zoom, I'm going to be moving you around a little bit. We also have in the human rights space. Oh, yes, sure. That's a great idea. Thank you. We also have what we identify in the paper as gender under crisis. And in a way, this continues on from what Ivanka was talking about in that piece, which is looking at the fact that while we have at the moment a really important discussion in gender discussions about gender, who's included, who's not, the issue of sex under international human rights law and the way in which it perpetuates and continues these binaries, we also have at the same time a number of commitments and rights that have been increasingly articulated over the last 15 to 20 years in the area of what could be considered as gender equality, the removal of gender discrimination, and gender parity. And these are about introducing notions of equity, also addressing issues around discrimination on the basis of gender and on the basis of sex. Now, for all of the progress in these areas, we also know that there is not consistency across these commitments. So we know that, for example, the SDGs have nothing to say about LGBTQI rights. We know that there's inconsistencies in relation to how different United Nations agencies and indeed states bodies conceptualize access to abortion as a medical right, as a human right, as a public health need. And we know in particular the World Health Organization has had a number of recent debates about this in its assembly processes in the last couple of years. And we also know too that there are genuine disagreements around concepts such as child marriage and its relationship to gender versus other aspects of communal, social, and economic rights participation. So when we're thinking about gender under crisis, one of the things that we really want to articulate here is that there are these concerns about what the current commitments don't include and what they don't reflect on and what they don't accommodate. But there's also genuine disagreement about the concept of gender rights and the rights that should be embedded within conversations around gender parity, gender-based violence, sexual and reproductive health and human rights, and so on. We have blocs within the United Nations amongst the member states that identify themselves as family friends of the UN. And then the last couple of years, they've been pursuing these collection of states different understandings or different rival aspects of what gender means and how it should affect, to what extent international human rights are decided at the Human Rights Council or the World Health Organization should be permitted and should be allowed to change the way in which they conceive and understand their gendered norms and gendered rights within their own community. And this is an anonymous quote from an ambassador that was quoted at the end, actually, of the Human Rights Council, 56 Human Rights Council in June, about the way in which they perceived this conversation around a special procedure that was held on achieving equality for women and girls. And it was the West has been in the ascendancy of the Human Rights Council for so long and has used predominance to push more ambitious resolutions and language from a socially liberal perspective. And for other Islamic community of states and African states, it's just too much. Now, I would argue that we need to be cautious in the way in which these groupings are presented sometimes in a quote like that. We know it's far more diverse and diffused than the presentation of these blocks. And then that would be, I suppose, my but to the other hand, would be when we're thinking about groupings such as Family Friends of the UN, we need to acknowledge that, for example, this year in the executive board for the World Health Organization, when it was just having a debate about whether or not to recognize the Center for Reproductive Rights, some of the countries that came forward and strongly advocated for the center to be given membership were ones who came from African states in particular that were identified in that block by that anonymous quote. So again, this gender under crisis, I think, is legitimate and something that we are talking a lot about, but the way in which should be attributed with weakening it, fracturing it, crisifying it, I think needs to be thought of with a lot more consideration. So it was under that context, I suppose, of two competing crises, the way in which the global health multilateral mechanisms were perceived to have failed during COVID-19, to be equitable, to achieve cooperation, to achieve and promote preparedness and response. And at the same time, this growing concern about any effort to try and advocate for new international human rights instruments, to what extent they will necessarily be able to promote or progress. I need to move around a bit. Here we go. I was too still. To what extent do they need to promote or progress or harm the gains that we've made in human rights spaces, particularly gender and human rights? There's been a lot of conversations, particularly in another area of work that I do, the peace and security agenda, that we're seeing at the moment this real concern around backlash if you try and progress certain concepts around gender at the moment in international processes. They have a strong risk of being reversed or actually, dialed back. And so there's a sense that you need to tread with great caution at the moment in the international field when it comes to thinking about any international agreement that will have gender inclusions within them. And so that background for Claire and I was really the point of interest then when we were looking at the convention, agreement, or other international instrument on pandemic prevention, preparedness, and response, which for the rest of the time I'll just refer to as CA+ or pandemic treaty. That was suggested in May 2021 by the World Health Assembly. So the World Health Assembly agreed in 2021 that there should be the creation of an intergovernmental negotiating body to try and draft an instrument that would address the absence of a number of mechanisms that were required during COVID-19, but also bizarrely, I suppose, advocated as an instrument that would complement the international health regulations. And I say bizarrely because I don't know this personally, but I've been told anecdotally that supposedly there was a conversation in 2020 with the WHO Director General that there should be something like an agreement or some sort of instrument in place where states have to cooperate. And supposedly he turned to them and said that there is one, it's called the International Health Regulations. But by that point, the genie was out of the bottle. And this political pursuit then for this instrument then began. And it had a fair amount of state interest in the fact that the new resolution to draft and negotiate it was agreed to. And the ambition was that both the IHR, the International Health Regulations, and interrupt me if, I'm assuming here that you know what those are, but if you don't, please interrupt me. That's largely a particular form of regulation that exists that identifies the way in which states should cooperate in response to public health emergencies of international concern, which was the way in which COVID-19 was described back in January 2020. Those should undergo amendments. At the same time, there should be the drafting of this agreement that could take the form of either a regulation itself or indeed a convention. And the ambition was that this would happen and be adopted by the 2024 World Health Assembly. So when Claire and I came to then study the way in which the conversations have proceeded about the CA+, we were really interested in it from two perspectives. First of all, obviously, as I said, that prior understanding of how multilateralism would be pursued in this environment, what would be the way in which the framework would be designed and the intention to have effect, how, and also to what extent it would also consider gender in it. And the reason why we were really interested in the degree to which the CA+ would identify gender in particular was because of the volume of criticism about the absence of gender inclusion in a vast number of epidemic and pandemic disease events that have been happening for over 10 years, in particular under the way in which the current international health regulations have been operationalized. There was a systematic failure, if you like, to really think about the way in which the absence of gender data, the absence of gender planning, the absence of gender inclusion into the operations, the advice, the recommendations, was impacting on the way in which states were prioritizing gender in their responses. And we looked at that in particular in a previous paper across a number of different health emergencies, where the absence of specific recommendations or gender inclusive recommendations meant a real significant different gendered impacts in these crises. And so we were really interested to see in this conversation, particularly given also we had a number of states at the time that were declaring themselves to have these newly adopted feminist foreign policies, to see to what extent they would, put their I suppose, their commitments on the table and really advocate and pursue gender inclusion in this process. It would also have been a really significant moment as well for the World Health Organization, because if this does end up happening, there's not a large number of international treaties under the current remit of the World Health Organization. So one additional one that doesn't also include gender for us would have been a really significant move in terms of the way in which we can think about how the World Health Organization is progressively understanding and thinking about responding to calls for gender inclusion in its processes. But we also need to acknowledge as well that the World Health Organization as an entity, and even the INB, which was set up to draft the treaty, can only go where states allow them to go. It has to basically accommodate the desires of a multitude of over 190 states that want different things from this agreement. And there's also an awareness, again, looking in the gender literature, that we often know that at that international level, particularly in other areas where our work, such as including peace and security, that it's often at that intersection of conversations around the agenda, whether it's peace agreements or, peacekeeping operations, gender is the one that can often be traded away. And so we were wondering to what extent when gender would appear in these conversations, and then how long it would be able to persist and what shape it would take in these conversations. in these draft negotiations. So what we did then is we traced the evolution of gender inclusive language in the 7 drafts the CA passed to date. And we acknowledge, coming back to what I had in an earlier slide, that we are using quite an explicit count here. We're looking at the words gender and women. We did look for men. Men were not cited at all. We did use a range of other types of intersectional words to identify gender and women, but none of them appeared. Gender and women were the 2 that most consistently appeared throughout the 7 drafts, but as I'll come back later, even those are not that strong. We wanted to basically understand to what extent here, not only when these words were appearing, but how they were being used and what they were being identified in terms of recognition versus participation or versus, a simple count. Then after we had done that, during the process of late last year and most of this year, we have been trying to, when we can, get hold of states and stakeholders who are involved in the IMB process. And I can talk a little bit about that later on, but that has been an incredibly difficult process. And we've been really surprised at the degree to which it's been really hard to get people to just have a casual, anonymous, chat about what they're advocating for, how they're finding the experience in the IMB. So really happy to take questions and conversations about that and why we think that's happening. And we entered into this project, I have to be honest, largely inductively. We kind of came to it thinking this is a really big moment politically, we sensed, and we wanted to just try and understand what was going to happen. And I'll come back to then how we've started to now think about it more theoretically, now that we actually have a little bit of a better sense and understanding of what the data is showing. So as you all know, there's a number of components that are under the CAA plans, but the primary ones that we've identified in the paper, and that has been identified through the way in which the draft has been developed over time, is that it's primarily concerned about, first of all, it has a preamble, which is meant to then sort of indicate the operations and the workings and the value statements of the treaty. We then also have guiding principles, which is basically like these concepts or these principles should apply throughout. That's like, for example, the international health regulations with reference to human rights in Article 3. So there's this idea that should apply throughout, similar here. Then the areas that are really of interest, if you like, to those states who are currently advocating and tussling the content of the pandemic treaty is access and benefit sharing for obvious reasons due to the gross inequalities in that area. Workforce, which again, we know now with, workforce has always been one that's been identified even in the IHR, but it's one here that has come out particularly in light of the fact of the rights that they have as a workforce and the needs that they have as a workforce, and also the protections that are required. International cooperation and coordination is again about the interoperationalization of the treaty with the IHR and who processes and the way in which it should be, put into action in the event of such a pandemic. This content here is about whole of government society approach, and that one's starting to become a little bit less content over time. But originally the idea here would be that there'd be general principles here as well, or inclusions, specific articles. And some of them are still there, so around areas like education, data collection, and so on. And then finally, representation on committees. And so this one is about the way in which the who should be on the committees, how often the committee should meet, what type of committees they should have, and so on. And what we have seen over the way in which the drafts have progressed over time, and at the very end, the 2 that we have in red here, what you can see is the proposal for the Hugh Pandemic Agreement at the moment. That was the one that in April that was then put forward to the World Health Assembly in May that failed to progress. So there was meant to be a successful vote then to basically adopt the treaty. That didn't take place. So they basically then agreed, the World Health Assembly agreed that they would spend more time discussing the text and reconvene in September this week, November, and then possibly the World Health Assembly next year to vote on the final text agreement. What we have noticed is that, first of all, I suppose there was a survey sent out to all member states about what they think should be priorities in the treaty back in May 2022. And I think they had only about half the number of states, less than half the number of states would actually respond to that survey, which I think already starts to give you an indication of the degree to which states are entering into these processes. But what we've seen since then and the way in which the drafts have developed, in that survey, gender was identified as being a very low order priority. So it came out really low in terms of the way it was ranked against a whole range of other rights inclusions, and also the way in which it was sort of grouped as in terms of where it should appear. There was sort of a comment that there was sort of some survey indicating that they thought it should be in whole of government, and then others indicating it should be in guiding principle. So it didn't really have a great start in terms of the states that completed the survey and their perceptions of how important it was. And I think that kind of then was reflected in the first draft. And then you had quite a strong backlash to the absence, but particularly by non-states, but also by a number of countries when they read that draft. And we know that through interviews where they were quite shocked at the degree to which it didn't really appear. And so there was quite a strong campaign for the next draft to have a lot more inclusion and content. And that strong argument kind of persisted for the next 3 rounds. But then after that, what we start to see is this gradual weakening. And just almost by the end of the current proposal, a weakening to such an extent that I didn't do the slide with the numbers, but we basically, when you see the 2 X's there, you're seeing 2 references in the entire text, 1 reference to gender, 1 reference to women. And the reference to gender is in the context of we recognise gender equality as it's been identified in CEDAW, and the other one is we recognise that that women and girls need to that fall under the SDGs and gender equality. So even then, it's a reference to other instruments primarily to think about it. The workforce is a reference to women, and that one's maintained. And that one is, I think, and we argue in the paper, very much due to a very strong, successful civil society campaign for women global health workers, for that mention to be in there. So we then took these findings and went and chatted in interviews, tried to make sense of why we saw that low, high, fall, dramatic fall. And what we heard was a number of really different competing explanations. And I should add, we really tried to make sure here that we sampled a large number of low, middle, high income countries, those who identify as having a feminist foreign policy in particular were ones that we were interested in. But then it became so hard, we ended up just sending blanket emails to anyone whose email address we could find to be able to talk to them, as well as civil society organisations who are campaigning in the space as well. And what we heard were, I would think, the following there 6 that I would group that were the consistent themes that we heard. The first one was that this is just a low order priority. And that in particular, a lot of countries took their guide, or a lot of those who are involved in the drafting took their guide from that survey and just assumed that this was not going to be a place to campaign too much. And the impact, it was mentioned a couple of times as well, the impact of the WHO Executive Board and WAR debates was also fresh into drafters' minds. They were already aware this treaty was contentious, and they wanted it to get through with as much minimal resistance as possible. Another area that I thought was really interesting that came up a number of times, which was that gender is a secondary consideration. It's a secondary consideration in the context of a health emergency and a pandemic. It's not something this treaty can apply itself to. The treaty needs to be really specific in terms of what it can do, what it can achieve, and trying to, in the way it was put to us, trying to reorganize the way in which gender is thought about and approached and configured in societies and states is not the job of the treaty. The third argument that we heard was that the whole process itself is a big mess, and that if it had been based in somewhere like New York, where there's a lot more practice of negotiating and resolutions of this kind, these types of instruments, we wouldn't necessarily, thank you, have this outcome. The next one was that feminist foreign policy countries reassured us that they had experienced significant pushback, and they were the ones there in that second and third draft really pushing for inclusions, and they were really shocked to have their inclusions just repeatedly, strongly knocked back. The final two was definitely attention within ministries and language. So one, which is really interesting, one of the low-income feminist foreign policy countries said to us that they were really shocked at the degree to which they were often having fights within their own ministries about the language. That this was that we needed to have a really in-depth understanding of the fact that this had been a failure in advocacy by those who wanted gender inclusion, because there had been a large direction of efforts to the health industries within World Health Assembly, and actually it should have gone much broader. In Geneva in particular, there should have been approaches to consulates that have positions over Human Rights Council in other areas as well. And then finally, the other one that was said to us was that gender's been a really useful trade-off. The reason why we see it diminish over time is because it is the one that gets traded away. So how do we think about this? And I've only got 2 more slides. So I think at the moment, in terms of the big picture, what we were sort of thinking about here was, well, okay, to what extent could this be an illustration of a crisis for gender human rights? Is this sort of, if you like, the first warning that we're hearing about the way in which ministries are telling us that there's fights within ministries about its inclusion? Groups are anticipating pushback, so they're reducing what they're trying to achieve. States themselves are showing real serious fractures over this. So are we seeing, if you like, potential here for a real concern, or to use the norm language, of the death of, if you like, to be extreme, of a gender human rights norm? Particularly if this ends up going to being approved, it would be an instrument that has one of the lowest actionable references to gender. The other option is to think about, well, actually, is this just telling us something about the way in which the international health regime works? And we need to not get too carried away about trying to think about the relationship between gender and health multilateralism. This is actually indicative of global health multilateralism rather than indicative of the progressive norm of gender. And so in the end, we came up with a couple of explanations, and I'm really keen to hear conversations and thoughts because we're currently working through these. These are where we're wrestling with at the moment. So at the moment, we thought about, well, okay, if you think about this at the moment, we're talking about an international health regime trying to manage a number of competing norm clusters, and one of which is this idea of cooperation between states to prevent and prepare, cooperation around equity, and also gender as one of those within it as well. And we were thinking that at the moment, there's sort of 3 ways in which we can think about this. The first one is not to panic, that actually the pandemic treaty is a political process. And even if we end up with a result where the gender representation in this treaty is not whatever volume we think it should be, and we're starting from a point where we don't know what that ideal volume should be other than it'll be low, that we need to think about its meaning in this use. And this is where Antonio talks a lot about in relation to norms, that you can see the same norm take on different characterizations, different usages, depending on the political condition in which it's being thought about, in which it's being used. And you need to really pay attention to that particular context, look at commitments that emerge from that, the way in which that norm is understood, before you sort of declare anything here is a crisis. The second explanation is that actually the pandemic treaty could be an indicative of a political process that we are going through at the moment at the international level. And this is very much to do with what Berger and others have been talking about, which is the fact that at the moment we're looking at the liberal script of human rights is under challenge. And there is a morphological claims of human rights that are evolving at the moment. There's economic, social, cultural, there's natural rights. There's actually non-human rights. We are in an environment right now where the rights themselves are undergoing rival claims. And so what we're seeing here is a rival claim between equity and between gender, and also a number of other rights as well that could be possibly going on here. And so we need to be really careful not to assume here that what we're talking about is a norm death, but we certainly need to be attentive to the fact that what could be happening is the obsolescence of the gender norm, its replacement, or just its failure to compete. And then the final explanation here is that the pandemic treaty itself is a flawed political process. And there's that, in a way, all international treaty events are flawed processes. And this comes from a really interesting article that's been done by Mosquito and Perez in 2023, where they look at the history of the way in which UN General Assemblies debate and have adopted resolutions over a long period of time. And they basically show that you just get a lot of idiosyncratic behaviours, and you get groups that emerge and change over time. And the result that you end with at that end point is an indication of what is the political debate at that time. It's not the same as conditionality like we know. It's very much about paying attention to the fact that you've got politics happening here with state level ambitions. It doesn't necessarily need to be in one particular condition, though they argue that this needs to be tested. So we thought this could be something that we could look at here, which is then thinking about what we're actually seeing here is prior groupings, assembly, rearranging themselves. They're really actually concerned about the pandemic and who has power in this process. And even concepts like equity, PABs, One Health, and gender are byproducts of a wider struggle that's going on. So where to from here? For us, as the researchers here, what's most frustrating is that we can't read submissions. We can't read. We've tried to watch as many of the conversations as we can, but there's been no transparent process in the IMB. And that for us is really frustrating, is the fact that it's meant to be a deliberative process, and yet we really can't. We're basing a lot of this on interviews and counts and drafts rather than being able to read submissions, which is quite unusual for a process that's gone on for this long. We're waiting to see what is the end result of the CAA Plus and see how it happens. We might be looking at number 3. It's just an abject explanation 3. This was just a failure in politics. But we also think too that there's something really interesting about explanation 1, which is that idea of it's a trade-off, and that we need to be attentive to is this understanding that in these political conditions, trade-offs occur, and then try and understand why this was the one that continually came up in the conversations as being the trade-off. And I think we do need to pay attention to the fact that there is this sense of a saturation limit, the sense that there's only so much you can include in treaties and agreements that sit outside of particular areas like Human Rights Council, and the World Health Assembly is one, where there's this consciousness of what they're there to do. They're a technical agency, they're a technical assembly. And then I also think as well, we need to actually still pay attention to the challenges to gender as well. And this is the norm obsolescence argument and explanation too, which is that, and we heard this a little bit come forward in our interviews, which is that equity is a higher order priority than gender. And I think that's one that I think we are starting to see a little bit more in other forums, and we need to pay more attention to it. Thank you so much. And I hope I didn't talk for too long. I really, really welcome your questions.
Thank you so much. Feel free to ask questions or raise. Yeah. All right. Yes, Hoji?
Okay, you want to go first?
No, you can go first.
Okay. Thanks. Can we go back to the slide on the 3 explanations?
Yes.
I think it might be helpful for me